Tameaka Lakey is a health promotion officer with Ballarat Community Health, and she's going to be talking to us today about a whole school approach to relationship and sexuality education. So thanks, Tameaka.
Thank you. Is that sharing correctly
Yeah,
from the
you're all
notes
good.
page or anything? Okay, well, thank you for that lovely introduction. Yeah, so my name is Tameaka, and yeah, I work at Ballarat Community Health. Might have met a few people in the room, but not everyone. And I do apologize if you saw me present something very, very similar at the conference in Shepparton. But this is more of an extended version, so there's more detail in today's presentation. So my portfolio at Ballarat Community Health includes sexual reproductive health, BBB and STI prevention, but then also it includes healthy and respectful relationships and the prevention of gender-based violence. So I kind of wear two hats. Most of my work utilizes the socio-economic framework. So basically, we're working in schools around that whole of school approach to health and well-being. And so this is all primary schools, secondary, P12, specialist, as well as the flexible learning schools that we have here in Ballarat and little country towns around Ballarat as well. So but getting to the why. So children and young people are reporting that there are still many gaps in their knowledge, attitudes, and behaviours around sexual reproductive health, healthy and respectful relationships, gender, diversity and sexuality, and even body changes and puberty. We as health professionals and educators want them to learn about these things in a safe and supportive environment, so school, rather than online from like influencers on TikTok or even worse, pornography. These gaps often exist because many teachers don't feel well equipped or have the confidence to deliver comprehensive education. And then they're often also bringing in their own values, opinions, experiences, or bias about sex, sexual health, and relationships into the classroom as well. And I'm sure this resonates with schools in your area as it's evident across the state. It sort of doesn't make sense because we've got, like the mandate around respectful relationships, sexuality, and consent education that needs to be taught in all Victorian government schools and Catholic schools. There's lots of different resources available. Plus, there's us as health promotion or health professionals going out and offering education in schools. Yet, because it's quite ad hoc, every school sort of doing it differently. Even within schools, the classrooms are getting different education as well. So unfortunately, we're still finding that we're coming up short for children and young people. And this is also prevalent during discussion around gender stereotypes and gender-based violence, which can also be triggering for students and or teaching staff. So Tabby is speaking after me all about the Respectful Relationships program and the whole of school approach there as well. So it is well resourced. It's just about how we're implementing it that I think we can do better. But then also there's also perceived concerns about the change in language, especially around sex, sexuality, gender, and diversity. And then also concerns about saying the wrong thing or giving incorrect information. So really putting it in that too hard basket. And then we're thinking about parents and carers when they've got to put their 20 cents worth in as well. And then being worried about what is age and stage appropriate for the classroom. And so as a result, these fears and worries often mean that many teachers put RSE, as I just said, in the too hard basket and either only teach what they feel comfortable with or they outsource it to external providers, which we can do parts, but not all of it and not in an ongoing capacity. Or worse, they just don't teach it at all. As health professionals, we may have the knowledge, passion, and expertise, but unfortunately, we just don't have the resources, capacity, or time to be able to teach comprehensive RSE that covers everything, especially when it's relevant and meaningful for children and young people. So that age and stage appropriateness. The data evidence is very clear in saying what we need to do, and schools are well positioned, but we need to work more collaboratively and work together so it's not so ad hoc. So if we're thinking about the aim, comprehensive RSE is most effective when implemented as part of a whole of school approach. This approach embraces the partnership between the student, the home, or their parents and carers, the school, but also the community. So all of us here today as well. The goal of RSE is to build on knowledge, skills, and behaviours, enabling children and young people to make responsible and safe choices. Also, developing protective factors such as resilience and social and emotional competencies will enhance the potential for critical thinking in children and young people. So, how do we get started? I think firstly, we need to identify what and who in your area are your local assets and set up a working group. So then that way, then we can continue to share the load based on our organisation's capacity, but also our funding requirements and our strengths and interests as well. This is really important. Ideally, community health is best positioned to lead this work, as community health promotion officers are very familiar with the whole of school approach using the achievement program framework. And essentially, often it's community health nurses that are delivering the face-to-face puberty in primary schools and sexual reproductive health education in secondary schools. However, there has been change to CHHP, Community Health Promotion, funding from Department of Health. And so what we're finding is many of the smaller community health promotion teams are quite limited to only working with schools around healthy eating and active living, just due to funding. So I feel like, we've got enough people in the room here as part of the COP that, we should be able to find a local champion that'll be able to take the lead and coordinate and support the schools through the process, or come together as a working group and we all take a little part each, so then it's coordinated. So these are just some ideas that I've had. Essentially, these are who I have at Ballarat Community Health working in my team. So there's myself as a community health promotion officer. We've also got our community health sexual health nurse. We've got our Department of Education Respect for Relationships school liaisons, or for you, it's Tammy. And then the secondary school nursing team, SERSH, your local women's health org, and then as well as the local public health unit could help as well, because often I've noticed a lot of the public health units have sexual reproductive health as one of their priority areas. So let's tap into that and start using those resources a little bit more. But then there's also other services in your area like CASA or VicPol who, might be more working in the response area, but are doing some prevention work as well. So they could be great assets to your working group too. And sometimes it's good to have that different perspective as well. So you've got people working prevention, education, but also in early intervention and intervention as well. If we have everyone in the room, we can really see who's who and who's actually doing what. And what potential gaps there may be in your area that may be challenging for schools to meet the sexual health and relationship benchmarks for best practice. If you want to, I can also come along if you need, especially in the beginning, just to help you get started. Probably have to be online though, because I feel like otherwise I'd be traveling all week to get to other parts of the state. But anyway, offers there if you need. So with the whole of school approach, so in Victoria, we use the achievement program. I'm assuming everyone's heard of the achievement program, but if you haven't, that's okay. I'm just going to give you a quick 101 anyway. So it's based on the World Health Organization Health Promoting Schools model. It's supported and recommended by Department of Education as best practice. So the whole of school approach strengthens the relationship between health and education, and it does this by linking the Victorian Public Health and Wellbeing Plan with FISO 2.0. So FISO is the Framework for Improved Student Outcomes 2.0, which previously for schools it used to be literacy and numeracy, but then recently wellbeing's been included as well. And then also the Victorian 2.0 curriculum. So if anyone wasn't aware, the Victorian curriculum was recently updated last year. So yay. And then as you can see down on the right-hand side of your screen, the framework covers 8 health areas. So this includes sexual health and wellbeing. That's the pink one that I've got circled. But I call it sexual health and relationships because it seems to work better when we're talking with schools if we're using school language. And so they're used to hearing relationships from respectful relationships, but then they're also used to hearing sexuality from RSE. So yeah, I often just say sexual health and relationships or puberty in primary schools as well. It's really an umbrella term because we're really thinking about it as being sexual reproductive health, sexuality, gender diversity, and respectful relationships all together. So it's putting it all in one place. Um, the Achievement Program framework and all of its resources are free for all Victorian schools through the Achievement Program website, and it's supported by the Cancer Council. It is important to note, as I mentioned, really using language of schools. So often when we're working with primary schools or a faith-based school, they may be hesitant to say that, oh, we're working on sexual health at our school. So particularly if parents or carers are already worried about what's being taught in the RSE curriculum. So this is where we get creative and use our values-based messaging approach and say or frame it that we're working under safe environments or the safety health area instead. Because at the end of the day, what parent, carer, or teacher even will say that they don't want to keep children and young people safe. So, using those values seems to go a long way. And really, we know that teaching comprehensive RSE is a protective factor in keeping children and young people safe. So once a school registers on the Achievement Program website, they then connected with a local health provider, which we can set it up with the Cancer Council. That'll be your working group. Then the school is asked to complete a sexual health and relationship baseline survey to help assess where they're at, what they need to achieve best practice, and what do they want support with, as well as identify any issues or challenges that they're already seeing in their school that may not be listed in these questions. And then armed with this information, we can then tailor our support with our working group. I suggest actually going and meeting with the school and going through the baseline survey with them. So then you get a bit of an idea of what's going on, put a face to the name, and then because sometimes if you just get a mark, you're like, oh, 3 means fully achieved, 2 means partially achieved, and 1 means not yet. So especially if they keep giving themselves 2s, it'd be like, okay, so what are you doing and what do you want to do better? It ends up being better in a conversation. But essentially we find that the whole school approach is really broken down into 6 areas. And if they can tick off these 6 dot points, ta-da, best practice. So this is why I say it does require a lead person or organization just to be able to champion and facilitate the school through the step by step, just to make sure that we're ticking it off, and then we're able to also coordinate external organizations or services or providers about where they're fitting in with the whole of school approach as well, just so that everyone knows what they're doing, who's doing what, and we have accountability. And then, as we know, schools are very clever in getting external providers to come in and teach the content that they don't feel comfortable or they don't want to teach. So, there might be services working in some schools and not others, or doing bits here and doing bits there. So it's really good if we can get everyone working together, then it doesn't matter what school a child or young person attends, that they're getting that same consistent messaging, information, and referral pathways. So each dot point, what does it look like? So the first one is leadership and commitment. So first and foremost, this involves the school having strong leadership support and commitment to creating policies and practices that promote and support RSE and respect for relationships at their school. So this is having the principal, or generally we work with the assistant principal. They seem to have a bit more time on their hands and can make decisions. That yes, our school is committed to best practice in relationships and sexual health, and we're here to support our teachers in teaching the curriculum, but also if parents or carers have any issues, that the principal will be able to answer those questions as well. Essentially, government schools have all of these policies already. So these are just recently been updated by Department of Education, which is awesome because it means that all our government schools already meet this criteria. But if they are a non-government school and don't have access to these policies, we do have a sexual health and wellbeing policy template, or as you can see here, I've renamed it and called it the Healthy Relationships Policy. Because as I mentioned before, primary schools or faith-based schools are a bit reluctant to say we've got a sexual health and wellbeing policy. So really everything else is the same. I just changed the title and it seems to work wonders. So anyway, figure that out. So yeah, there's the policy to then also be endorsed by school council and leadership if we need to draft this new one. The next part is our welcoming physical school environment, which really is an environment that's safe and inclusive. So this is like the school office, all the grounds and schoolyard, the buildings, the classroom. So when someone walks in, whether it's a student, staff, family member, someone from the community, or just someone who's maybe thinking of attending that school in the future, they can see that it is a safe and inclusive environment. So these could be using things or things that are quite visual. So things like rainbow flags, stickers, posters, lanyards, student-led pride groups and activities, days of celebration like Ida Hobbit Day, things like that. It can also be like Body Safety Australia posters, so like our network of helping hand or our body safety rules. So when they are being taught in the classroom, these posters are also around the school as good reminders for children and young people. We've also got our safe school posters, information, and safe schools can also work with schools around gender affirmation plans for students and staff too. We've got our sexual health Victoria posters, just a few there. We've probably all seen these ones around. I particularly love the consent is like fries one. That seems to be a real winner in a lot of our schools here in Ballarat. But then also information about local health services. So these are just two that we have here at Ballarat Community Health. Our blue one is like our general BCH poster that we pop up in staff rooms and also are in school newsletters. And then the pink poster we actually put on the back of toilet doors. So like in staff rooms or in secondary schools, we can pop them on the back of the toilet doors for students as well. It's got a QR code that they can quickly scan the QR code and make an appointment at one of our clinics if they need. Um, it's also about having free menstrual products readily available, inclusive school uniforms, so it's summer and winter, not boys, girls. And then also schools that every school has school values. So what do those values actually mean? Instead of just having respect, resilience, or whatever it might be on the wall, actually show, well, what did that look like? What kind of behavior? What are our expectations? To give it meaning for children and young people as well. And let's face it, I'm pretty sure if it's not 100%, it's 99.9% of schools have respect as their school value. So it really gets children, young people, staff, and families being able to talk about, well, what does respect look like? We've heard that word so many times, but it means so many different things to different people. Um, which then brings me into the next point, which is, that healthy school culture and supported staff. I'll start with supported staff first. Let's remember schools are a workplace, so they must provide a safe working environment for their staff. So this includes OH&S, sexual harassment, bullying and harassment policies, diversity and inclusion, etc. Like you get it. But we often hear teachers are feeling stressed or underappreciated, disrespected in their classrooms by some of their students. And so, under the Achievement Program framework, we also work with schools to support their staff, so improve staff health and wellbeing. So this could be encouraging self-care practices, healthier behaviours, and develop positive school community where staff feel valued and supported. If staff are feeling valued, supported, they then can also help provide, have I gone too far? A supported that healthy school culture that they can be positive role models and be confident in using inclusive language and calling out inappropriate language or behaviors. So they're demonstrating those behaviors for the children and young people in the school. So then they can, peer-to-peer call out behaviors and be active bystanders as well. So this can also be professional development can be provided by a number of our organisations. So like in Ballarat, we have Women's Health Grampians, and so they provide gender equality, intersectionality and prevention of violence against women, PD for our school staff. Respect for relationships also have like responding to disclosures, so particularly around when teaching topics 7 and 8 of the respect for relationships curriculum. Safe schools have free training around inclusive practice. Minus 18 have some really great training around pronouns and gender and diversity. But then there's also the RSE Education by Sexual Health Victoria, and now the online modules that Kim just mentioned too, that Saoirse are providing, which is awesome. So that was around RSE and answering questions with confidence. Is that right, Kim? Yeah. Awesome. So another great resource. Which then brings us to the curriculum. This is what, schools are wanting. Um, as we know, RSE, for it to be comprehensive, it needs to be taught over a number of lessons or workshops and over a long period of time. So from foundation all the way up to year 12. And if us as health professionals are providing it face to face, the number that we of workshops or sessions that we need to do adds up really, really quickly. One school in Ballarat, we've got one school that has like 12 year nine classes. So if we weren't to go out to every year nine class over those 4 or 5 weeks, that's 100 sessions just at one school. So I've just sort of made up those numbers as I was saying it. So if they don't quite add up, please don't hold me accountable. But the idea is they add up really quickly, which then means that our capacity to be working with other schools or other projects and other things also becomes competing, and it gets really stressful. Um, and also, if we keep offering the same ones every year, there's no building the capacity of teachers, but also there's no endpoint. It just means every year that would be then going back, providing that same workshop for the next year. So it feels like it just goes on and on and on. No wonder we feel so busy and time poor, really. And look, as long as we keep offering the service, of course, schools are going to continue to take it up because it's free or low cost and it ticks their boxes and they don't have to do anything. And let's face it, that's how we do it. We were talking about it at Ballarat Community Health that we wanted to move out of this space, but then schools just kept pestering us. I had one school that had 4 different teachers pester me asking the same question, and I just had to keep giving the same answer. But then by the fourth one, we ended up giving in and doing it. So essentially, they got what they wanted by, being bullies. And then what did they do the next year? Did it all over again. So, yeah, if we keep giving in, then they're just going to keep asking for it. So COVID was kind of really good in a way for this, for Ballarat Community Health, because it gave us time to actually take a step back and work out, well, what are we going to offer schools moving forward? Where do we fit into the curriculum? What is going to have best collective impact for the children and young people? But then also, how can we ensure that it's not just a one-off random presentation, because they needed to fill a gap as well. So, being able to tick all those boxes has now allowed us after COVID be like, oh, sorry, due to change of funding and COVID, we don't do that anymore. And schools have actually been quite responsive. So it's starting to work really well, which is awesome. So like in primary schools, we don't teach any face-to-face RSE with students. What we do is then we provide support to build the confidence with teaching staff, whether it's during a staff meeting or help them plan their curriculum. Or if they do have a question box and they're not sure how to answer some questions, they can send us an email or give us a call and we can go through the question box with them. And then we also offer information for parents and carers. We do this because we feel it's best practice to be taught by the school staff, because if we're thinking about that network of helping hand, a teacher and a parent or carer, a part of like a primary school age person's network of helping hand. So after the RSE lessons are being taught, if they've got questions later on, or they may need to disclose later on, they've already been able to identify that their classroom teacher is a safe person that they can talk to about anything and everything. So we feel like that is really, at the end of the day, best practice and what has the best impacts for that child. Whereas like in secondary schools, we do it a little bit differently because RSE is taught in the health and PE curriculum. So we work with the HAPE teachers to develop their curriculum. But then we also find one lesson that our sexual health service can actually deliver. So this puts a face to our service for the young people for if and when they may need access to our service. They know who we are and where and how to access. But also, we can sort of tailor it a little bit more to be able to discuss topics or content or answer student questions that a teacher wouldn't normally be able to cover as part of the curriculum. So whether it's more things around like STIs and BBVs or like talking about PEP and PrEP or contraception or also mentioning terminations as well, because essentially often there be particular things that teachers won't touch. Um, and then once we've sort of worked that out, also if there's schools that want like additional support, we then connect them with other external providers as well. So like Body Safety Australia or Elephant Ed, Man Cave, Consent Labs, that kind of thing. And then we have also in the past pooled our resources and worked with Sexual Health Victoria and had them come up to Ballarat and invite. We had two sessions, one for primary schools, one for secondary schools, where we invited every school in our region to come along and upskill in RSE. And by pooling our resources means that we could fund it. So then it was free for schools. So they only had to pay for cover to then release the teacher for our training. So that could be something that you could do as well, or at least, pull some resources and then provide at lower cost for schools as well. Because I guess, remember, got to work smarter and more collaborative, not working harder and being more time consuming. And really thinking about what services or what programs we're offering schools and why. And sorry, my phone is ringing. I'm just going to hang that up. There we go. And then also, you know, previously we've always been like, oh, we're the one-stop shop, we do everything. But essentially, there are other organizations or other services that maybe actually can do it better. So, really being able to take that step back and then getting someone else in and sharing that load has helped us a lot. So, there's so many resources, activities, websites, books, videos that are readily available for educators to access and use. Some are free, some are paid for. However, knowing what's out there, how to find it, how it aligns with the Victorian curriculum can be a real challenge for teachers, especially when they're so time poor. So, see what I mean when I said there's so much out there that there is no excuse that there should be gaps in knowledge, in attitudes, behaviors, and knowledge for children and young people, but it's about how we put it all together and work together. So, at BCH, I've created this resource that combines all of those resources in a easy step-by-step guide to the whole of school approach as well. So it's trying to make it easy, one-stop shop for everything for schools to use, mapped out against the new Victorian curriculum. I literally released this, I think it was it last year or the year before, I can't remember now. And then within a couple of months, the new curriculum came out. So it was already outdated after 3 months. So I had to go back and redo it over the summer holidays. But that means that I could put the new respect for relationships, resilience, rights, respect for relationships curriculum as well. So I did them both at the same time. So that was all right. um, but as you can see, this one is actually only for primary schools at the moment because years 7 to 10, I'm still working on it because, I have all this free time, but it is coming. It's a work in progress. Watch this space. Also used or worked with Ben when he was at Sersh, when he was putting together the teacher resource cheat sheet, which is awesome, but it's also against the old curriculum, so it needs to be updated to 2.0. So I put it in this one for primary, and yeah, this secondary it's coming. It's not completely wrong, it's just some slight tweaks that we need to make. So like I said, leave it with me. It's a passion of mine, so leave it with me. I also have this on the BCH website, so it is readily and easily accessible. However, I don't tell schools this. The way that we do it is When we meet with schools to do, whether it's to sign up to the achievement program or they've signed up and we're going to work on the baseline survey, I'll take a printed copy and show it off and be like, look at this great resource, and this can be yours if you register, have your leadership commit that you're going to work towards best practice for sexual health and relationships, and then I'll give you access to the booklet or to the toolkit. But yeah, they have to do all those steps first. We're not just going to hand it out willy-nilly. But yeah, it is on our website if you are looking for it. I'm happy to share it with you. But yeah, don't share it with your schools unless they're committed, yeah. And then just to finish off, we've got our supported families. So we know it's the school's responsibility to teach a comprehensive curriculum, but really it is that shared responsibility between the student, their parents and carers, the school, and then community organisations such as us. So we can do this by encouraging students to share their learnings at school when they get home, but also through discussion points shared in the newsletter or homework activities. We can also share information through blogs, new family induction booklets, informal catch-ups at pickup or drop-off time, emails, meetings, school events, social media, all the ways that we can engage families. We have offered family information nights or family information sessions around school assembly. And schools say they want them, but historically, we've had like 2 people show up. Once I had none. One school I had 1, but they made all the staff come too, so it was a full room. So that didn't seem so bad. So we're kind of thinking maybe that's not the way to go. We did offer a parent information session when we had Sexual Health Victoria in Ballarat, and we opened it up to all the schools, and I think we had about 15 people come. So that might be the way moving forward. I'm not sure. Also, it is like a lot of people, really focusing on the secondary schools because that's where the young teenagers are. But also just to be mindful that primary schools, a lot of their staff and or parents are part of that reproductive age as well. So getting information to parents at primary schools can also be really useful. And also some of them might be our priority populations for BBV STI prevention as well. So often it's, primary schools are overlooked when it comes to sexual health and information, but I think, it can be really beneficial. In our toolkit, we've also got access to all of the family resources as well. So schools can copy and paste, chuck them straight in their newsletter, or, on their socials or whatever, however they want to connect with their families, along with some tips on how to have conversations around puberty, sex, pleasure, consent, and all that kind of stuff. And then last but not least, our community partnerships. So establishing community partnerships and referral pathways to local health services is important for the whole school community, as referrals could be for students, particularly those in secondary schools, but as I just mentioned, staff, parents, carers as well. And so this can be done through our meetings with schools to let school staff know about your services. Or if you do have capacity, maybe doing a face-to-face education workshop for students as part of their RSE curriculum. But then also we can do staff professional development and support, or give information for newsletters. And then as mentioned in our healthy physical environment, we can also have all our posters on display in our staff rooms for newsletters or on the back of toilet doors. Has been really helpful as well. And that's pretty much it. Sorry, I've probably gone over time. I can talk forever. Oh, these are some of the posters that we have, including STIX, which is on hold at the moment, but hopefully that's back up and running at our library soon. But yeah, so it's just sort of promoting our services without actually having to do much. It's just like put them around the school where they're visible and easy to access. And then just to give you some figures on the last 12 months, because I'm doing my reporting at the moment, we actually have 33 schools working through the achievement program, but it's 18 of those that are working through sexual health and relationships. 7 schools have finished, so have done best practice, and we still have 11 that are currently working through the process. So this is primary, secondary, P12, and our specialist school as well. And so, and I always say we, not me, because in our team, we have our Women's Health Grampians, City of Ballarat, Respectful Relationships, school nurses, Ballarat CASA, VicPol, Headspace, and Q Hub. So it is really a collective. But it means that we've got a reach to over 11,000 young people attending a school using the whole of school approach, which is 1,670 school staff. And also reaching over 7,000 parents and carers receiving our sexual health and relationships information and referral pathways, which is big numbers. Yeah, so we're pretty proud, if you can't tell. And really why we're pushing or encouraging people to really try and take that step out of delivering and doing the doing. I know it's really hard because we're really passionate and I love having those conversations with young people. But it does mean that these requests from schools will never end and schools will never build their own capacity if they don't have to. So working in partnerships and sharing our resources and capacity means that you'll be able to do more and have great collective impact. The end.
Wow, Tameaka, that was fantastic. Thank you for sharing all of that. Just really, really highlights how many factors go into integrating RSE genuinely through the whole community, through the whole school community. So, and that toolkit you've developed looks amazing.
Thank you.
If we got questions, there must be some questions. Those numbers are incredible. Joanna said in the chat, yeah, they really are. You're making a big difference. That is great. I'll just give people a bit of time to pop their hand up or stick a question in the chat, or just take yourself off mute and feel free to jump in.
I might jump in. It was really interesting. I think love what you're pushing around. Let's not just constantly be on that wheel of providing education. And it's something that I hear from a few different community health that we work with in the health promotion space around. We need to build capacity because we can't do this for every school, every request, every year level. We just cannot. But I was really interested in where you might have seen where engaging families and carers and parents in that space has worked well. You talked about kind of some of those resources and like opportunistic engagement and how the structures we've got at the moment around trying to put parents' nights on. If there's parents in the room, they'll go, please don't invite me to another parents' night, probably. But I'd love to hear if you've seen anything that's worked really well. I know in the early years space, sometimes, and unfortunately with the environment at the moment, that safety stuff, we seem to get good buy-in when people are really little around safety and safe conversations and body safety. And then as they get older, it starts to move more into sex, it falls off. So any advice around where you've seen something work really well?
So that is a space that we want to grow in the next sort of 12 months. So seeing as we've got all our structures in place, it's the parent engagement that we want to work more in. We've been chatting with our women's health Grampians as well because yeah, we feel like it's missing. So at the moment we've just been dipping our toe in by providing information. But yeah, definitely don't want to be doing the parent information nights at this stage just because they're so poorly attended. Or if they do come, you're sort of like preaching to the converted already.
Yeah.
But yeah, it did work when we had Sexual Health Victoria come up and we opened the parent session to all of our schools. What we thought we might do as well is maybe we sort of separate Ballarat into like 3 areas. So we've got our North, our Wendouree, and our Sabas area that maybe we open it up to a few schools in those areas. So then they don't have to travel as far maybe, but then also can share information and, ask questions and, so it might be a bit more viable for us as well if we can have, 3 or 4 schools or parents all coming together. We haven't done it yet though, so that's sort of where we're at the moment.